Mr. Johnson, a 65-year-old man, presented to his primary care physician with a 3-month history of pain and swelling in his right groin. The pain was intermittent at first but had been constant for the past 2 weeks. He denied any trauma to the area but reported a history of heavy lifting at his job in construction. Physical exam revealed a bulge in the right inguinal area that increased in size with Valsalva maneuver. The area was tender to palpation. There were no signs of obstruction. The remainder of the abdominal exam was benign. Laboratory studies including complete blood count and basic metabolic panel were within normal limits. An ultrasound of the groin showed a right inguinal hernia containing a loop of bowel. Mr. Johnson was referred to a general surgeon for repair of the inguinal hernia. He underwent an open right inguinal hernia repair with mesh placement. The procedure went well without any complications. He was discharged home the same day. Commentary questions. What are the most common causes and risk factors for inguinal hernias? Inguinal hernias are often caused by increased intra-abdominal pressure and mechanical stress on the abdominal wall. Risk factors include older age, male gender, family history, chronic cough or constipation, smoking, pregnancy, ascites, PAM, heavy lifting, and prior abdominal surgery. How are inguinal hernias classified? What is the difference between direct and indirect hernias? Inguinal hernias are classified as direct or indirect. Indirect hernias occur lateral to the inferior epigastric vessels when abdominal contents protrude through a patent processus vaginalis. Direct hernias occur medial to the epigastric vessels due to a weakness in the posterior wall of the inguinal canal. What diagnostic modalities can be used to evaluate an inguinal hernia? Physical exam is often sufficient, but diagnostic imaging such as ultrasound or CT can confirm the diagnosis and provide additional details about the size and contents of the hernia. What are the indications for surgical repair of an inguinal hernia? Asymptomatic hernias may be observed, but surgical repair is indicated for hernias that are symptomatic, incarcerated, strangulated, or at risk of obstruction. Elective repair can prevent complications. Urgent repair is required for incarcerated or strangulated hernias. What are the options for surgical repair of an inguinal hernia? What are the pros and cons of open laparoscopic techniques? Open repair can utilize tissue-based repairs or mesh reinforcement. Laparoscopic repair is a minimally invasive option, also utilizing mesh. Open repair has a lower recurrence rate but longer recovery, while laparoscopic has faster recovery but higher recurrence risk. Mesh helps minimize recurrence for both techniques. The choice often depends on surgeon experience and patient characteristics.